Welcome everyone to our Welcome Change series. And today I am very excited because we are joined by Andrés Rubiano. Andrés, you are a true rock star in the world of global health. You are a physician, researcher, educator, and the director of Meditech Foundation, which is transforming emergency care in low resources settings. I read that you also work with the World Health Organization, helping build stronger and more equitable emergency systems around the world. And of course, you are an Ashoka Fellow, recognized for your groundbreaking social entrepreneurship in health. So thank you for being here, Andres.
Hi, Anna. Thank you for the opportunity of being here in this important spot. I think having the opportunity of discussing many of these things of our daily life activities is really important and share that with the Ashoka community, but also with many people around the world. Is a unique opportunity for, having the possibility of taking many of the different messages to many places around the world. Yeah.
Thank you, Andres. So I wanted to start with a very easy question, which is what inspired you to become a doctor? And why did you choose to focus on emergency and trauma care?
Ah, that's the question. So I think when we grow, initially there are so many different type of, explanation of why you decide to do something in your life. And definitely, sometimes it change. And when you go in deep into many of the issue that was behind the decision, um, there are like more insights from now that for. So obviously, when you decide to go for healthcare careers, and especially in medicine, definitely it's something that is related to your desire to help people. That's a main motivation. But actually, there is an important concept in healthcare that it applies to medicine that is the social contract in healthcare. That's something that we
You said the
have
social
for,
contract, the social
yes,
contract. Hmm,
yes, it's something that we have for granted as healthcare providers, but
hmm,
sometimes we really don't go in detail of what does mean.
hmm,
And it's something that is attached to the historical development of the healthcare people. And is that at the beginning, many of these careers, especially careers like medical doctors, especially surgeons, were starting by, artisans and people from the church,
hmm,
uh, in early times, many of the people that was taking care of the people, especially in battles and things like that, were people from the church, you know, nuns and all these hospitals that were dedicated to take care of people with disease, and that had been evolved to something that is really interesting. That is that this is a trade-off between the physicians and the society, and that means that they give you some sort of benefits, like are represented in that they give you a lot of confidence. They give you also the possibility to be recognized at the society level. But the trade-off is that you will be dedicating most of your life to take care of the society.
hmm.
And I think at the end, this is something that you learn. There are many people that really want to take care of people, and this kind of vocation that you have with this kind of processes is really framed by this social contract in medicine.
Hmm. It's clear that it's not becoming rich or wealthy, your motivation, seeing your story.
Yeah.
Of all the healthcare sector, no?
Uh-huh.
Just a reminder to our audience that you can type your questions so I can add them at the end and ask them to Andres. Meanwhile, Andres, how did you start, like very briefly, improving trauma and emergency care for people in remote or vulnerable communities in Colombia? How did you start?
I
What did you see and what did you change?
yeah. When I was already involved in medical school, there was something that was called attention to me, especially in the city that I was trained of, that was Cali. at the time, Cali in Colombia was one of the most violent cities because all this history of uh, violence related to drug trafficking and everything, especially in cities like Medellin and Colombia. We are talking about 80s and 90s. And for me was especially calling attention the amount of patients that will arrive with injuries at the university hospital. And the question was, we were understanding and being trained how to do what to do with these patients inside the hospital. But sometimes the life of these many victims depends on what they do outside the hospital.
Hmm.
So I volunteered to start going out in a very initial project of ambulances in the city, going out and taking care of these patients at the field. And it was, something that I really like, I really enjoyed to have this opportunity of
Hmm.
helping to save lives even before arrival to the hospital. And then it was connected to the continuous of care inside the hospital. So when I did my social medical year, that is something that you need to do in Colombia, especially rural populations and sometimes in cities outside the main cities. I was very fortunate to arrive to a city in the border, with the jungle areas of Colombia. That was the last area that have almost all the complete resources for taking care of the patients, but there was not organized pre-hospital care there.
Hmm.
So I start doing, you know, social entrepreneurship. I didn't know what was that at that time, but I was doing some development of projects for taking care of these patients at that moment. And that's
Hmm.
how I was very focused on emergency care and trauma.
Hmm. Thank you, Andres. I think you are being too humble. I was this summer in Colombia, I must say to our audience, and I hadn't met Andres before, but everyone was telling me Andres is really the person that has shaped healthcare in this country, especially for trauma and emergency. No, so even though I see that you have this humble personality, I wanted to ask you, how can, from when you started, that you started seeing these things to now, it is so clear that what you've done has saved thousands of lives, no, and has changed things. Do you have a story or numbers that can help us understand how a change like this can change thousands of lives and improve thousands of families?
I think one of the main pillars of that has been dedicated from those early times to education and educate different type of populations, not
Mm,
only healthcare providers at main hospitals, but also outside hospitals. So I
mm,
remember when we started training people from very rural, remote areas of Colombia, in how to do work with these patients, even in absence of high level of resources, and was something very spontaneous. We don't understand at that moment the impact of that. So we were just, teaching and trying to uh, give knowledge to people to take care of patients outside.
mm,
And for me, I think the main story has been many years after uh, meeting people that we trained 20 or 30 years ago that
mm,
are now, in important positions for taking decision and policy making all around the country.
mm,
And they just arrive and speak with you, and say, I really appreciate what you did at that time.
mm,
And they are now in charge of many healthcare providers in different institutions, and it's like a legacy. So it's something that I think my main history, we are full of histories of people who save lives with the skills that they obtain with our training. But I think the most important now is that many of that people that at that time were very, junior people
mm.
starting as volunteers or something like that now are directors of uh, national entities that are deciding about healthcare policy making. So I think that's the main one that really impacts what is happening.
So I would say education is key for you, no?
Yeah,
Hmm,
totally. I think has been an
hmm,
important vehicle that can bring
hmm.
to this point many things. Yeah.
Thank you, Andres. Now, changing gears a little bit, you often say that health doesn't just begin in hospitals, but in our homes, communities, and the nature around us. What do you mean by that?
I think that's also something that has been more structured recently, and also within the work of Ashoka, especially a recent project that we made at Andean region, uh, led by Juliana, is that uh, we were very focused and actually one of the evolving point that we have with our foundation is that we move not also from education but also for research in
Mm,
clinical areas like 10 years ago. Um, and what happened was that it's really important at the healthcare sector to generate evidence of whatever you propose, because you can propose many ways of acting and protocols of care and things like that, but you really need to test if that is affecting the outcome of the patient. So it's really saving life, it's really improving healthcare in general. So we move into being really well structured and training with international collaboration in that topic. And and at the point that we arrived to this project with Ashoka, that was, now that is all the discussion about climate change and how the
mm,
ecosystems are being affected and how that affects healthcare also transversally, is that we start moving all our resources for research in order to understand the evidence of the impact of healthcare and nature.
mm.
And we found a lot of really interesting data regarding how just exchanging in nature environments and being, immersed in nature really brings a lot of benefits for the health in the population, and it's pretty logical. We have all this movement of ecological improvement around the world, and you always say that's for the well-being of the societies and communities and the people and humans, and how is that connected also with the animals in the planet and things like that. But now there is evidence about specific prescriptions of healthcare activities related to nature that affects in a positive way, your body and your physiology, and how it also prevents further complications, and how can serve as a really huge complement to traditional medicine, to the regular healthcare systems.
Is this already happening? So are there doctors where that are prescribing time in nature? Like, Anna, you need to spend 3 hours a week in nature and you will be better. Is this happening?
Yeah,
Really?
there are some efforts we found, especially in some Asian countries, areas
Mm,
like Japan, for example. There are medical societies that have been starting to be dedicated to something that they call like forest baths. And that means that they prescribe being in
mm,
outdoors and specific areas in nature. And as you mentioned, how many hours, for
mm,
which kind of conditions. So it's something that is starting. It has been growing a little bit, and we need to understand really more in detail. But as,
mm,
as I as I mentioned before, these need to be linked also to research, because
mm,
what happened in general medicine is that you always need to discuss at scientific level with numbers and with all these
mm,
statistics and things like that.
mm,
And in order to arrive to that point, you need to have all this research methodology and start
mm,
evaluating that. And I think that's a key opportunity for areas like Latin America, because Latin America is still one of the areas of the world that have a lot of green
mm.
and is the perfect laboratory to evaluate many of these situations.
It's interesting because I wouldn't be expecting this message from you as a neurosurgeon, you say, that
Yeah.
you use this high-tech medicine to save lives, no? How do you balance that high-tech neurosurgeon with your belief in simple things like nature? W- Is it
I think we are
complementary?
nature.
We are
We are
nature.
in a recently discussion. We have a recent webinar with Ashoka Latin group. And we were specifically discussing that with some of our friends from the Ashoka network that was a lot in nature and ecology and all this. And we are nature. We cannot be separated of that. Even if you use high tech, things, and also the science that has been able to develop like medications all around the world, because this is something that need to work together. We cannot separate.
Mm.
And now with the science that has evolved, we understand, for example, that there are genetic conditions that even if you do a lot of exercise, even if you take a really good care of your diet, you
Mm.
have been genetically decided to have problems, especially, for example, with the management of your cholesterol, all these situations that have a high risk of cardiovascular conditions. So you need to mix this and add this to medications also. It's something that
Mm.
is synergistic, but definitely being connected with nature and understanding the impact of the well-being of nature inside all your daily activities, and even how you can reduce complications of comorbidities.
Mm.
There are very well designed studies related to improvement in pulmonary diseases, improvement in mental health diseases,
Mm.
improvement in cardiovascular conditions, cerebrovascular conditions, just for being immersed in nature. So it's something really amazing, and we cannot deny that. We just need to move ahead and bring
Mm.
all this together.
And prove it, no, with more data, I think.
Yes.
What is, Andres, your dream for the future of healthcare, especially when it comes to caring for both, for people, for planet, for the university, for the universe? What is your dream for the future?
Oh my God, my
Or
dream
your
is,
strength? I think, where do you think we are going and what would be your dream?
I think when we go to many of these global meetings, for example, at WHO of that level, that you have like a big picture of what is happening around the world. Um, there are so many barriers that are mostly based on political and other actions that generate barriers for having access to even this. We were discussing, like, for example, if you see how many cities are growing in different regions of the world, what is coming is that being exposed to green spaces, parks and all these areas, is becoming a luxury. So what you see is that in many populations and in many cities, most of the people does not have this access to this kind of environments, and that's is not fair. It's like it's pretty clear that if you reduce your exposure to green spaces, you're going to have more complicated conditions of health. So I think in what I see is that there is something that is starting to grow. We have a lot of um, like uh, a lot of also challenges in big networks like Ashoka, for example. That we have so many people around the world trying to fill gaps and trying to develop ideas to improve well-being around the world,
Mm.
and and we need to face this type of discussion at different levels. It's like, for example, how we are going to link many of the projects that interact and
Mm.
intersect within these topics, in order to just do not being working on a specific health condition, but also in the environment around that.
Mm.
We were discussing about how some hospitals now are increasing the green areas inside the hospitals,
Mm.
but it's also, if you go over many regions of the world, you have two extremes for that. Is
Mm.
some very very poor hospitals that are in rural areas that have a lot of exposure for
Mm.
green because in the area that they are. And
Mm.
if you go over the main cities, there are very luxury hospitals that have access to these kind of things. But
Mm.
in the medium, there is a lot of people that are not exposed to that. So there are many challenges, and we need to try to overcome that with the people that
Mm.
we are working with. So uh,
Mm.
that's how I see the future. We are moving ahead. We start that discussion. We think that it's not too late to do things, and we need to work all together. This means
Mm.
the health industry, the social entrepreneurs, the governments, and the people. The end, the
Yes.
people is the one who moves governments. Mhm.
It's interesting because what you said about connection with nature in hospitals, being at the two poles, no, the maybe very poor rural hospitals and very rich, wealthy hospitals, we see it in general in connection with nature. Our kids, for example, kids' connection with nature, and so very interesting area there. So, Andres, I wanted to ask a question that comes from the audience, from someone from the US, and I will read it because it is very well written. So it says, it seems like the medical profession keeps moving toward hyper specialization versus integration and holistic patient care, which is what you are mentioning. What can health systems around the world, like here in the US, where I live, learn from your work that helps break through the silos and actually serve patients better? Does that have to start in medical school?
Yeah, totally. I think that's a really great question and needs to start from medical school. We have been working in some education projects that we are evaluating the pro-social conduct in medical schools, and it has been reduced in an important way. So that means that many students in the past were there really because they want to help people. But as they bring into some role models of the commercialization of medicine, this has been decreased in an important way. So I think attaching that to how the environmental aspect is very important,
Hmm.
maybe can go back to change that and regain the prosocial conduct in many of the medical environments and in healthcare environments. So definitely that's something important. And this is also attached to what we have been discussing about evidence and
Hmm.
clinical studies, because in general, when we go over technical discussions in medicine around the world, the
Hmm.
science that has been produced all around the world regularly has been more accepted if the science is coming from high income settings. You know,
Hmm.
when we start producing science in the southern area of the globe, sometimes it arrives or it needs a lot of effort to position in reverse way through the high income settings. But this is something that we have been working on a lot in some specific topics. And maybe the international collaboration between high income settings and LMICs, that will be a key aspect to move
Hmm.
this topic around the world.
Hmm. Thank you, Andres. Now, a more personal question. My niece, Amaya, that Andres knows, she's a medical student. She's been incredibly lucky to do an internship with Andres this summer, and now has such an inspiring role model. So, what advice would you give to Amaya and to all medical students in the world that are beginning their careers? What would you tell them?
No, I think that was a really great experience that you mentioned. They have the possibility of receiving many students from around the world and starting working with them. I think my main advice to Amaya and she as representative of many young medical students around the world is that they really need to continue moving in what they are confident, what they really have in mind. If they really want to do a big change in the world through
Mm.
medicine, they need to continue. You know, when you go over your medical career, you have many people when you struggle with trying to change your view and your perspective. And as I told you, if you have a very profound humanitarian way of seeing things, sometimes,
Mm.
you know, there are so many people that you find that say, you don't have time for that. You know, you need to move very technical in some specific aspect.
Mm.
And that's not the real issue. You really need to maintain your confidence and your beliefs. And if you really want to move into all this new movement that has been developed, you need to continue doing that. Will not be easy, but you need to do it.
I like it, Andres. So when I was in Colombia this summer, you were traveling. I was there 15 days and you were traveling 14 days of the 15 days. How many days per year are you traveling, Andres?
At this moment is a lot. Yeah, yeah. I think I am in a moment of my life where I am really trying to move the message. And in order to move the message, you need to travel a lot because, as I told you, especially if you are from an LMIC area, it's
Hmm.
more difficult, and people sometimes just understand many of these things when you are there face to
Hmm.
face discussing.
But what keeps you motivated to be
No, I think my main
also that
motivation
strong?
is to
Hmm.
change things. That's my main motivation. And that's why I still keep, moving a lot with many of these messages that we have in different topics. And especially, well, trauma care is one of our main topics, but also moving
Hmm.
in parallel with all these topics like health and nature.
Hmm. Thank you, Andres. And one question that I always love to ask to Ashoka Fellows around the world, because we need to learn ourselves. When you became an Ashoka Fellow in 2012, was it?
Yes.
What changed? What did Ashoka bring to you? I know you brought many things to Ashoka, but what did, becoming an Ashoka Fellow, what did it mean for you? How did it help you? And how do you think it could help other social entrepreneurs in the field?
No, for me that was a enlightening process because, I have been working in all these topics since, I don't know, 1990s or less, something like that. And in 2012, when I become an Ashoka Fellow, that was the first time in my life that I understand that I was doing. It was the first time that I really understand I was a social entrepreneurship and that what I was doing was trying to change the world. And this is the power of Ashoka, it's bringing you by example in order to see the work of other fellows, but also with all the tools that they bring in this process to really enlighten you and say, okay, you are doing something that is not crazy. You are doing something that it really helps the world, and we are here to support you. So this is a very important backup for all these things. You know,
Hmm.
Before being an Ashoka Fellow, I was just continue doing education and all that stuff and trying to develop protocols and things, and I was doing that because I enjoyed that. But I didn't realize the impact of that at that moment.
Hmm. It's so beautiful to hear this because this is what we want to bring, no? This light that helps you and empowers you and makes you understand that you are not the only one and you are not alone. So, one final question, Andres, that I have for you is you are there inside of the operating room as a neurosurgeon. It is so difficult for me to pronounce this word. What skills do you learn, have you learned in that room in your detailed work that help you to advance long-term system change, like this balance between the philosophical macro work and the super rigorous work in an operation room, in an operating room?
Uh, I think the technical skill that you develop as neurosurgeon, as in any of the surgical specialties, is that you really understand how at that level you can fix small things in the operation room, but it brings a lot of meaning, like working in the brain that someone that
Hmm.
can, you are working in the whole life of that people, you know you are working in situations where if you do not operate the patient at that moment, that life is lost.
Hmm.
So it's not the life of that person, but also what that means for the family, what that means for the area what that person is living. So it's a lot of pressure, but also a unique opportunity of doing something for the work, for that person, but also for the work. And I think the possibility of generating like pathways of how to use these skills in a very organized way, in the actual era of all
Hmm.
these difficulties that we have around the world, because when we arrive to hospitals, there is always this discussion about we don't have enough resources.
Hmm.
The insurance levels of the person does not bring the opportunity to bring the best technology, or sometimes, we are some few people in the hospital. Uh,
Hmm.
Now, for example, in Latin America, there is a lot of crisis in the health sector. Colombia specifically have a lot of crisis in health sectors. So people don't feel sometimes very comfortable working in many environments. So there is a lot of other issues that also mix with your skills and what you have been trained for.
Hmm.
So that balance and how to move uh, the teaching that balance to the new generations.
Hmm.
It's something that it's become very very tricky,
Hmm.
and I think is where I am most concentrated now. Is like bringing all this experience that we have been accumulated over the years, and try to move that to the new generation that need to continue doing in a similar way or in the best way, focus on the patients. Uh, and that's why I start this conversation with the social contract of the medical people, because I think if we continue in that essence of the original social contract, we can transit in all these technical aspects of medicine and surgery and everything, but like with a framework.
Hmm.
And if you go in the last couple of years, so many medical journals that write about bioethics and ethical
Hmm.
aspects in medicine, the main message for most of them is that we are losing the social contract.
Hmm.
And
Yes.
that's a very risky situation,
Hmm.
because if we lose that social contract, we will become just operators,
Hmm.
and not really all what we need to bring into the table for patients and things like that.
Let's not lose that social contract. Thank you for your work, Andres. It was a real, real pleasure to be able to interview you. Thank you for all the people listening now or in streaming. And happy Thanksgiving for those in the US or those celebrating happy Thanksgiving. Bye, everyone.
Thank
Thank
you.
you,
Thank you
Andres.
for the space. Okay. Bye, everyone.
Bye. Thank you.